Hi, for today I'm going to explain to you about our lifestyle that affect our respiratory system. I'm going to focus on about cigarette and vape. Are they same? Which one is better or which one is worse? Let's go. Firstly, I'm going to explain what is vape. So, vape contains a cartridge that has a liquid inside. That liquid is heated by passing through an atomizer which vaporizes that liquid and creates a vapor. Hence, the name is vaping. You get it? Firstly, the vapor will move into our nose, and then the vapor will enter a passageway called the nasal cavity. And also, the vapor can get into our mouth and go through the oral cavity. Both nasal cavity and oral cavity are going to end up at the same place, which is called pharynx, or in our words, we call it throat. And then the vapor will go into the trachea. This trachea stays open all the time because we breathe for 24 hours, right? Compared to our esophagus that only open when we are eating. And then the air will move down through the trachea and will get into two branches over there, which has the different side branches, which is right and left. The branches called bronchi, or for singular it called bronchus. The further branch into the tissue we call it as bronchiole. And then the vapor will reach into the smallest and the thinnest thing called alveoli. So, what's happened next? I will pass this baton to my friend to answer this question. Bye.
I'm Amira and I will talk about dangerous chemical in cigarettes and e-cigarettes, or we call vape. The first dangerous chemical is nicotine. Nicotine is a very addictive drug that negatively affects adolescent brain development. The average cigarette contains about 10 to 12 milligrams of nicotine, and we probably inhale about 1.1 to 1.8 milligrams of nicotine for each cigarette. Nicotine contributes to development of lung disease such as chronic obstructive pulmonary disease (COPD), lung cancer, and heart disease. Next is propylene glycol. Propylene glycol used to make things like antifreeze, paint solvent, and artificial smoke in fog machines. But in the e-cigarettes, it acts as vehicles for various concentrations of nicotine and different types of flavoring agents. The third one is carcinogens, which cause cancer, including acetaldehyde and formaldehyde. Next is acrolein. Acrolein used as a pesticide to control algae, weeds, and bacteria. It can irritate the lung, causing coughing and shortness of breath. Meanwhile, diacetyl is a chemical used as an artificial flavoring. In e-cigarettes, it's also used as flavoring, but it can cause permanent severe and potentially lethal lung disease. Cadmium generates reactive oxygen species that give a greater risk of free radicals. It can cause renal tubular dysfunction, resulting in proteinuria and decreased lung function by producing bronchitis, obstructive lung disease, and in certain cases, interstitial fibrosis. Next, we continue with benzene. Benzene can weaken the immune system because it damages white blood cells. Other than that, it has a negative impact on the bone marrow and can lead to a reduction in red blood cells, resulting in anemia. In e-cigarettes, it has vitamin E acetate, THC vaping liquids to dilute or thicken them. It will increase the fluidity of lung surfactant, causing the surfactant layer to collapse. In the cigarettes, it also have carbon monoxide. Carbon monoxide enters the blood from the lungs and combines with hemoglobin, blocking the blood's ability to carry oxygen to body cells, causes the blood to transport less oxygen. The heart needs to work hard to pump the blood and the organs get less oxygen. The last one is tar. Tar can damage your lungs by narrowing the bronchioles that absorb oxygen. It can cause emphysema and chronic obstructive pulmonary disease (COPD).
Assalamualaikum warahmatullahi wabarakatuh and very good morning. I am Sarah Sophia and my partner is Chong Li Ting. Today we are going to discuss about how environment nowadays affect the human respiratory system. The topic that we choose is air pollution. Before that, we have to know what is air pollution. Air pollution is a mixture of solid particles and gases in the air. It caused by solid and liquid particles and certain gases that are suspended in the air. These particles and gases can be bad for the planet and for our health. So, keeping track of them is very important. There are two common types of air pollutant that can reach unhealthy levels and affect lung health. First is ground level ozone smoke. It also referred to as smoke. Smoke is formed by a chemical reaction. For your information, ozone concentration can reach unhealthy levels when the weather is hot and sunny with a little or no wind. Second is Okay, what are the causes of air pollution? There are many causes of air pollution and I will give you a few examples from it. First is burn fossil fuels such as coal, petroleum and woods. Second, it came from the certain gases in the atmosphere. When the particle in the air combine with ozone, they create smoke. Smoke is a type of air pollution that looks like a smoky fog and makes it difficult to see. Third is exhaust from factories and industry. Manufacturing industry release a large amount of carbon monoxide, hydrocarbons, organic compound and chemical into the air. Thereby, it will depleting the quality of the air. And lastly, it because of the agriculture activity. Agriculture activity require insecticides and pesticide and fertilizer. This will emit harmful chemicals into the air and make the air more polluted. Example of harmful gases present when there is air pollution, which are methane, nitrogen oxide, carbon monoxide, and sulfur dioxide.
Hi everyone, my name is Chong Li Ting. Now I would like to present about the effects of air pollution on human health. There is a positive correlation between the amount of air pollutants and the number of respiratory ailments and other related infections. There are many effects of air pollution on human health, such as bronchitis, emphysema of the lungs, silicosis and dark lungs, and also lung cancer. Now, I would like to present about one of the effects of air pollution on human health, which is bronchitis. What is bronchitis? Bronchitis is the inflammation of the breathing tubes. In a more serious condition, the patient will have a fever, pain in chest, difficulty in breathing, and also continuous coughing. The second effect of the air pollution on human health is emphysema of the lungs. alveolar walls collapse and join with each other, thereby reducing the ratio of the total surface area to its volume. Therefore, the potential capacity of the lungs for gaseous exchange is reduced. Carbon dioxide that is trapped in the alveolus form bubbles and burst, which reduce the exchange of gases. The symptoms of emphysema, including difficulties in breathing and coughing, and also feeling tired. The third effect of the air pollutants is silicosis and dark lungs. The dust in the lungs can stimulate the growth of fibers round the dust particles. The settling of the dust particles and the continuous growth of the fiber tissues will finally reduce the efficient functioning of the lungs. The example of this ailment is silicosis, which involving the breathing in of silicon dioxide, which is silica, and also of carbon particles. Now, I would like to talk about the effects caused by air pollutants. There are many types of air pollutants, such as sulfur dioxide, nitrogen dioxide, small particles, dust, smoke or soot, hydrocarbons, carbon monoxide, ozone, and also heavy metals such as lead, mercury, cadmium, and others. Sulfur dioxide is quickly absorbed and acts on the upper part of the respiratory tubes. It reacts with the cellular components, the enzymes, and the nucleic acids. Sulfuric acid also reduces the pH of cells and upsets enzyme functions and denaturing them. The direct effect of nitrogen dioxide is the oxidation of fats in the cells. Other effects of nitrogen dioxide are similar to those for sulfur dioxide. The effects of small particles, dust, smoke, or soot depend on the types of particles. For example, carbon particles cause the formation of tissue fibers in the lungs. Other types of particles may act as mutagens, causing the chromosomes and the DNA of the cells to mutate. Next, carcinogenic hydrocarbons, such as benzoapyrene, reacts with cellular components and damages the DNA, mutating the chromosomes, and lung cancer will occur. Carbon monoxide competes with oxygen for the absorption by blood. Carbon monoxide also prevents the combination of hemoglobin with blood, thereby reducing the supply of oxygen to the tissues. Whereas ozone oxidizes the cellular components. Lastly, heavy metals such as lead, mercury, cadmium, and others will disrupt or stops the normal functioning of enzymes. The other effects of heavy metals are dependent on the type of metals. For example, lead damages the kidneys and the brain, lowering its alertness. Mercury kills the cells. Now I would like to present about the good habits to be cultivated in our daily life in order to maintain a healthy respiratory system. First, we must eat a healthy diet to maintain good general health and also improve our immune system. Second, we should exercise daily to stay fit and strong, which will also contribute to a pair of healthy and strong lungs. The third one, we should always breathe in through the nose so that most of the airborne particles are filtered off by hairs in the nose or are trapped in the mucus. Next, we should always practice breathing exercises. That is, breathe from the diaphragm and breathe in slowly and deeply. Lastly, we should wear proper protective devices such as facial masks to avoid breathing in polluted air. This is because the polluted air has airborne particles that may cause lung problems. The airborne particles consist of a combination of dust, pollens, molds, dirt, soil, ashes, and soot. The fine airborne particles are easily inhaled deep into the lungs, where they are absorbed into the body. Therefore, we should wear proper protective devices such as the facial mask if necessary. That's all from me. Thank you.
Ways to reduce air pollution. First, practice the 3R concept, which is reduce, reuse, and recycle. For example, reduce of usage of air conditioner as it will release harmful gases, for instance, ozone depleting chlorofluorocarbon, which will result in reducing air pollution. Second, reducing the usage of vehicles on road by practice the habit of carpooling and the usage of public transport, so less harmful gases that we will produce. And lastly, create awareness among the citizens. Awareness about the importance of reducing pollution on Earth can be created through campaign. For example, the Go Green campaign. Go Green campaign can encourage the citizen to plant more trees and to use recyclable items in their daily lives.